Harvard Health study found that Americans spend 10.4 hours a day on average between work and leisure in a seated position. In 1960, most jobs, 50% had moderate physical activity, and now it's less than 20% of the jobs. We're not gonna change your job, so let's put together a clear, precise program for mobility and unraveling that seated position. Okay, these are 6 life-saving mobility moves. This is gonna change your pain immensely, especially if you're working all day and you're spending 10 hours sitting at a computer. So what we wanna focus on is thoracic, hips and pelvis, and ankles. So let's get right into it. The first one, we're gonna do the ankle trio. So it's 3 moves. So the first thing I wanna do is I'm gonna get up against a wall or get up against a chair. So I need something for stability. And all I'm gonna do is I'm gonna come up on my toes. I'm gonna hold that for 5 seconds and take 5 seconds to lower myself back down. And I'm coming up for 5 seconds, taking 5 seconds to lower myself back down. And I'm gonna hold it up for 5 seconds. I'm gonna do that 10 times. I'm getting blood flow to my calves. I wanna raise myself up to about 80% as high as I can go. I don't want you to come all the way up on your toes and irritate a lot of tissue. We're warming up and getting blood flow to our calves so that we can make a stretch more impactful. So we're working on mobility. We gotta get blood flow to the area first. So now I got 10 repetitions of 5 seconds, 5 seconds on the way down. My second move I need to do exercise is I'm gonna do a stretch. I'm gonna loosen up that muscle tissue. So I'm gonna come here and I'm gonna keep my knee over my ankle. It can get to my toe, but I don't want it to go in front of my toe. So I'm gonna work on a calf stretch right here. So we have to do this in 2 different ways because we have 2 different calf muscles that are gonna be the most robust in our calf. So it's our gastroc and our soleus. So when my soleus does not cross the knee, my gastroc does. So when I'm doing this, when my knee's straight, then I'm stretching the upper portion. When my knee is bent, it's gonna feel like it's a lot lower. So I'm gonna do 30 seconds right here with the knee straight, holding this stretch. And then I'm gonna allow my knee to bend. It's gonna be gentle. I also wanna make sure that my heel stays on the ground. I don't wanna cause any pain in this leg. So I'm holding that. Now I'm gonna bend my knee, but I'm gonna make sure my heel stays on the ground with this stretch as well. So now you'll feel that stretch move down further into the calf. So you can get up and try it right now. So follow along with this video so that you can test these out and you're getting the right cues. So I'm holding my knee bent, but my heel stays down. I shouldn't have any pain in either of the knees while I do this. And I'm holding that for 30 seconds. So I'm just gonna switch to the other side. So knee straight, and I feel it in the upper portion right here. So knee straight, holding that, making sure the heel's pressed down. If you can't get the heel down from this distance, just come a little bit closer. Make sure that heel gets down all the way. Holding that for 30 seconds. Then I'm gonna allow the knee to bend and I'm keeping the heel down. Remember, this knee should not be way up here. That's where we start causing problems in another area. When we're trying to fix something, we start causing problems somewhere else. That's not an efficient way to get out of pain. So that knee stays bent. It's just a gentle bend. And now that stretch has moved down into this lower portion of my calf. I'm holding that for 30 seconds. And that's it. So we're done with number 2. Number 3 is we're gonna do a toe raise. So it's the complete opposite. Now we got blood flow to the back into the calves, and then we stretch them out, and then now we need to take up that range of motion that we gained. So we're gonna be firing this anterior tib muscle, the one that raises our foot and our toes up. And so I'm gonna get up against a wall, and I'm about my foot length away from the wall, and then I'm gonna raise my toes up. I'm holding it for 5 seconds. And then I'm gonna take 5 seconds, lowering it back down slowly. And I'm gonna raise up, I'm gonna hold for 5 seconds. With this one, it's really hard to get the full range of motion. So you can go as hard as you can within like the 2nd or 3rd rep, because it's really difficult to get this engaged because we don't do it. So like if you're doing this exercise, you're one of less than 1% of the population that actually does this and raises that up. And I can tell you that 99% of the problems that have plantar fasciitis, Achilles tendonitis, foot and ankle problems people are missing dorsiflexion. They're missing the ability to bend that foot up. So just by doing this, you're gonna be able to get ahead of a lot of those problems. And if you're dealing with it right now, they're gonna get a lot better. So I'm raising that up and as high as I can. Make sure that we're not just pulling the toes up, that we make sure we're pulling the whole foot. And make sure you have your shoes on. If your shoes are off and you're on a hard surface, it really puts a lot of stress on the heels. So on 5-second hold, and I'm slowly lowering down, and then a 5-second hold, and I'm gonna do 10 of these. So I'm holding that up as high as I can for 5 seconds, slowly lowering down, coming up, and you'll notice that you get less and less because that muscle gets fatigued because we just don't work it enough. So that's number 3. Let's get into number 4. We're gonna do an active pigeon. So what I need to do is come down, I do a lunge to get down to the ground. And then what I'm gonna do, I'm gonna lift up my right leg and I'm gonna slide my left underneath it. And then I'm moving this leg around right here. And so now I'm coming, we call this active pigeon. It's like a pigeon pose in yoga. But we're not gonna just sit into it. So I'm sitting into it for 5 seconds and then I'm spending 5 seconds deliberately driving myself up using the glute. And then I'm dropping back down. And remember, I'm dropping, when I do this, I'm not driving over to the side. Now I'm just twisting up in my back. When I'm dropping, I'm going straight back and I'm dropping my pelvis down towards my foot and towards the ground. 5-second hold and then 5 seconds driving back up. And I keep my back in a neutral position right here. I don't want my back up in this position. I don't want to be straight with my arms right here. All that does, I'm just irritating tissue in my back. I want to stay in neutral. I'm working on hip mobility, engaging, getting blood flow to those glutes while I'm stretching them. So I'm coming up, I just do that 5 times. And then now what I'm gonna do is I'm gonna switch sides. So my left leg goes up, my right leg goes under, and then now I'm getting into this position. I'm going straight down with my pelvis, and then now I'm taking 5 seconds to drive back up, very deliberate with that, engaging the glute. And I'm getting down a little bit lower into each stretch. Engaging the glute, coming down. Engaging the glute. Sometimes people have a question, what do they do with the back leg? So I just kind of inch the back leg back so I can get deeper into the stretch. I'm engaging, then it'll slide, back leg sliding a little bit. That's okay, I'll let it slide back. And I just do 5 of those. I get down, each time I get down a little bit further. And so we've loosened up our glutes and got more hip mobility. So now we want to use them more effectively in a standing position. So let's get into number 5. Number 5 is doing a hip hinge. So what I'm gonna do, I do it against the wall. So I measure my foot away from the wall and then I keep my face in line with my chest. I push my butt back. I'm hinging at my hips. I'm gonna do it up against this chair so you can see really good. So do it at the wall at home so you got a good measurement of your foot length. So depending on your size of your foot, that's the perfect distance for you. So I'm gonna go, I'm guessing here that I'm about my foot length. I'm gonna push my butt back. My lower leg stays vertical, like I'm like a stake driven in the ground. It stays totally vertical. My back stays in a neutral position, face in line with the chest. I push my hips forward. I push my hips back. I'm engaging my hamstrings and my glutes. So everything I feel, you should feel a pull in the hamstrings right here. And then you should think of, you got a grandkid that's pushing your butt forward, or maybe a kid. You think about you're crushing, I'm crushing my 9-year-old's head right here. And then now he's mustering up some strength and he's driving me forward. So that engagement should come right here where that attachment is from our glutes and our hamstrings, where they attach together, which is right here. And so I'm engaging and I'm doing 15, and then I'm gonna rest for 10 seconds and then I'm gonna do another 15. So this is gonna have the most reps because it's a movement pattern. We wanna get the movement pattern, we wanna engage these muscles. We're unraveling that seated position. This stuff is extremely important and very, very effective. Okay, number 6 is we gotta lengthen in our thoracic spine. So in this one, we can use a towel roll, we can use a double across balls, but really as long as we do it then and just lay flat on the ground, it's gonna unravel because we're all sitting at our desk like this. We got the office gremlin position. So what I wanna do is just lay down on the ground and I'm gonna get into a position where I have to open up the chest. So I'm laying down right here and I'm gonna get my arms up over my head. So I need to chin tuck. Get my arms up over my head. And I'm just gonna breathe right here. This is with a lot of our clients, this is their favorite exercise because it's the most relaxing. So what I really want to do is focus on my breath. You can meditate right here. Is a brilliant exercise. It's unraveling. I got to loosen up the chest. So I do my chin tuck and get my arms out to the side. And I just take deep breaths right here. Notice that I've kept my knees bent. If I straighten my legs out, now I've created this curl in my back right here because we all have a butt. So now I'm extending in my back and I'm not getting nearly as much. It's taking pressure off my thoracic spine and my rib cage. So when I keep that bent, that flattens out my back. I get my arms out to the side. If this is uncomfortable or painful, then you can do this right out to your side, palms up. You can put your hands right here. It's comfortable, but as you're getting looser and looser, you do this consistently, getting up here, getting all the way up over your head and taking those breaths. So I can sink. Each time I take a breath, I should be able to sink a little bit more. I reset my chin tuck and I'm lengthening out. I want to do at least a minute or just focus on doing 10 breaths, opening that tissue up. Follow us for videos on exactly what we do in the clinic and let us know if you want a more comprehensive plan. That's an easy, less than 10 minutes plan that's gonna help you get the mobility at your ankles, at your hips, and also at your thoracic spine so you can open up and unravel that seated position and get to feeling better and have the mobility so that you can continue to enjoy life. We'll see you in the next video.